Your Eye on Health tonight. We are diving into the American Heart Month. Up to half of patients, I'm told, who see a cardiologist for chest pain don't have blocked arteries. A little surprising, right? They still need care, though. They still want answers, no doubt about that. And to help us understand what's behind the symptoms and what doctors are doing to catch heart problems earlier, we are joined by Dr. Widmer, cardiovascular disease specialist, Baylor Scott White. So first of all, thank you for being here.
Thank you.
Share some wisdom with us. So coronary microvascular dysfunction. I'm impressed that I can say it all together cleanly. How different is that from, I guess, the typical heart disease that we kind of think about or grew up thinking about with our moms and dads and what most people know about?
Yeah, no, that's a great question. And the symptoms can be similar. And you'll have traditional chest pain, shortness of breath. But instead of a major stenosis or blockage in the large vessels, the epicardial vessels, we'll see maybe some dysfunction in the smaller vessels that actually are 80% of the coronary circulation and really regulate blood flow. So I like to tell patients it's like I-35. You know, I-35 might be running really well,
yeah.
But if you block all the exits and side streets, then people don't get to school and to businesses. So the microcirculation is like the exits and the side streets, so to speak. So that's what we're trying to focus on when patients have these symptoms.
Yeah, it's a funny reference because 35 for a lot of people, I'm going to the hospital, like right now, right? So you mentioned that many of the patients taken to the cath lab, they actually don't have obstructive disease when you see them. So with that, when symptoms come, but they're what you call angiogram, right?
Yeah.
That looks normal.
Yeah.
Walk me through that process. I'm not a doctor. You are. Tell us.
No, that's very fair. So we'll see people both with normal CT scans of their heart as well as angiograms. So when we go in through either the wrist or the femoral artery, we'll take pictures of the heart. And we won't see anything on the angiogram or the CT scan.
But I'm still feeling weird.
But the patients will still feel.
Yeah.
So then they'll come and see us in the chest pain clinic, McKinney and Plano. We have some chest pain clinics there. And we take a look and see what kind of symptoms they have, when they come on. And then we do a little bit deeper dive and we take them back to the cath lab and do some individual stress tests and look and see exactly where in the process they have their deficiency. Mm-hmm. We're able to really tailor their medicines and make them individualized for them and hopefully improve their quality of life and their symptoms.
Smaller vessels in the body, when they don't show up on routine tests, how do you diagnose, going back to what we talked about, the CMD at the very beginning, how do you diagnose?
So the definitive diagnosis is going to be back to the cardiac catheterization laboratory for most people. And doing that, looking at pressures and flows and doing some really nerdy calculations sort of in the control room, we're able to figure out kind of who has coronary microvascular disease or even coronary vasospasm. So it's really going to be in that setting in the cath lab. There are some non-invasive methods that we can use, CT, PET, and we can also use stress MRI. But those aren't always going to be definitive and still a little up and coming without as much reach as the cath lab has.
And is it so challenging because the vessels are so, I guess, small?
Exactly. So, you know, what you can't see, you can't really study. So we're using inferences and some different things that we learned in our many years of training to try to sort of...
This is part of that whole 7 years in med school thing or even longer?
Yeah, don't ask the rest of the family how long I spent in training. That's a funny joke. But yeah, no, it just takes a little while and takes a little experience. And then the fun part is really sitting down with the patients, and they're openly emotional when you say, no, you aren't crazy. This isn't your heart. This isn't your stomach. This is your heart. Yeah. This is what's wrong, and here's how we're going to help you. And they're very appreciative, so that's very gratifying.
It's funny you say that because, like, my own experience, my mom had some heart issues here and there. You know, she had catheters, she had a stent put in, and all that stuff. But there were moments when she went to the doc, couldn't figure something out, and she left feeling like, holy cow, I think I'm crazy, you know. Yeah, so that is a real thing, right? People have that feeling.
Absolutely.
If somebody's symptoms are caused by CMD and not major blockage, next level, how do you treat it? What do you do?
Yeah, so we have the mainstay of therapy is going to be lifestyle modification, so good diet and then exercise, cardiac rehabilitation. We have some medicines that we use, mainly that deal with blood pressure and heart rate regulation, and we'll use those mainly in people. But the exciting thing in CMD is that we're entering into some clinical trials where we're doing some things with gene therapy, stem cells. We have a stent that actually goes in the venous side of the heart, not the arterial side, to improve blood flow. And then we have some other things like flow therapy, counterpulsation therapy, where it's not pharmacologic based and patients can do that to improve their symptoms.
All right. Great info, Doc. It's a lot to consume, but it puts a lot of people at ease kind of hearing it, getting it straight from the doc. And no copay for you. How great. Got it for free tonight. Dr. Widmer, thank you, buddy.
Thank you.